in the list.
Do you see
Yeah,
her?
she's on.
Okay. No, you're good. All right, bye. Okay. All right. I've reached out to Tom. He's not picking up. Maybe he also mistook the time for 7 p.m. So let's get this moving. Looks to me we have a quorum present. Okay. Good evening, everyone, and welcome to the Planning Committee of the Common Council. We will call this meeting to order at 6:07 p.m. First, we're going to do a quick roll call. Ms. Shanahan.
Here, sorry.
Great, great. Mr. Livingston.
Here.
Mr. Sirenides.
Here.
Ms. Young. Ms. Young, you there? Darlene?
I'm here.
Great. And Ms. Smith.
Here.
And my name is John Kites. I am also present. Okay, great. All right, first order of business is the public hearing for the PY 45 Annual Action Plan Amendment to accommodate CARES Act funds 20 to 24 Consolidated Plan and PY 46 Annual Action Plan Amendment. Okay, we're going to be doing it where I will be calling the applicants in order as on how they appear on the agenda. So when you hear your organization called, do you mind just announcing yourself, telling the group your name, and if you could please keep your time to under 3 minutes. And with us, Sabrina will be keeping track and keeping time, and she will inform you when you've hit that 3-minute mark. So first up, we have the Carver Foundation.
Good evening, everyone. I'm Novelette Peterkin. I'm the CEO for the Carver Foundation. It's great to be with you today. So Carver Foundation is Norwalk Public Schools' largest partner in delivering before school, after school, and summer programs aimed at closing opportunity gaps for Norwalk students. Last year, we served more than 2,300 students. A majority of those students were served at in one of our 31 programs at 17 Norwalk Public Schools, side-by-side charter school, and at our community center. The Carver Center is home to K-8 after-school programs, Norwalk Public Schools expulsion and PODS programs, summer program, athletic programs, and community programs. We are seeking funding to upgrade the building's entrance and replace the 2 front doors, and to reconfigure a storage closet that is adjacent to the large foyer. This would provide us with the means for the receptionists to interact with people before and after they enter the building. So presently, people enter the building, they go through the foyer, to the original front doors, and they are uninformed or unannounced. They have to walk through the foyer and down the hallway to get to the main office. This new room to the right of the front doors would include an exterior operating safety window, and that would permit staff to greet and screen people before they enter the building. And adding an interior operating window would allow for continued safe communications once people enter the building. We are also looking to add glass to 8 existing solid doors to increase the safety for staff and students. In the past, staff would leave the doors open to communicate with others. You know, having the glass would allow for safe face-to-face communication with the glass barrier, with the glass serving as a barrier. The community center was built in 1970 with money from HUD. It's a Butler building. It was built to last 20 years. We have served, we have made several upgrades over the years with funding from CDBG. The enhancements that we're proposing today will play a vital role in helping Carver to maintain community morale while increasing the safety for all. Thank you.
John, you're muted.
That would help. Thank you, Ms. Peterkin. Any questions? Okay, let the record show that I believe Mr. Keegan has joined us. Is that correct, Sabrina? Are you there, Mr. Keegan? No? Okay.
Yeah, I don't see him. He might have just joined.
Oh,
I just
no.
heard the ding.
Oh, I mistook for, he put O. I thought it said on. Okay. I take that back. Okay. Moving on, we have the Domestic Violence Crisis Center. Do we have
He's
someone
on.
that would?
He's on now, John, just for the record.
Okay, great. Mr. Keegan has joined us. Tom, you there? Welcome.
As we used to say in grammar school years ago, I'm sorry for being tardy.
No worries. There was a little mix up with the times. Totally understandable. Welcome.
Thank you.
Okay, Tom, you haven't missed much. We just had we had the Carver Foundation speak, and now we're on the second organization, the Domestic Violence Crisis Center.
Thank
So
you.
whenever you're ready.
Hi, everyone. I'm Suzanne Adam. I'm the Executive Director of the Domestic Violence Crisis Center, serving Norwalk, Stamford, and the 4 area towns. DVCC provides an array of services to victims of domestic violence, both primary victims who have experienced domestic violence directly, as well as secondary victims, which may be children, neighbors, friends, family, even co-workers. We provide 2 safe houses. We have 1 safe house in Norwalk and 1 safe house in Stamford. We have 2 programs with both civil and criminal advocacy in both Norwalk Superior Court as well as Stamford Superior Court. Even though right now Norwalk is closed, all of our cases are being heard in Stamford. We also have direct services in terms of crisis intervention, safety planning, counseling, case management, programs specific to financial advocacy, as well as housing advocacy, and a large prevention education program that is in most of our schools throughout our 7 town and city area. Last year, DVCC served more than 4,000 victims of domestic violence, and in our prevention education programs, we reached over 7,500 individuals. I think the actual number is 7,590 individuals through our prevention education program. This evening, we are applying for a full-time child counselor. What we have noticed through this pandemic, the nation, the world have their eyes on domestic violence, and they're realizing that while everyone is being encouraged to stay home to stay safe, the individuals, victims of domestic violence, and specifically their children, are not safe at home. Throughout the second half of the school year last year and through the summer and the beginning of this school year, as most school systems are dancing between remote and distance learning, we simply do not have eyes on our children. These children do not have the voices that they need to be heard. The teachers, the social workers, the camp counselors, the neighbors, we are not seeing what these children are being exposed to in their homes 24 hours a day, 7 days a week. Referrals from the Department of Children's Families have been down for a very long period of time, throughout months. And actually, when we expect to have an incredible increase in September, when kids come back for summer camps and they're with their teachers again, we're not seeing that spike in referrals from the Department of Social Services. What we are seeing, however, is a spike in parents and family members reaching out to the Domestic Violence Crisis Center because they are concerned about the children who are at home and who are not receiving services. These children are not receiving social interaction. They're not seeing normal, warm hugs and support that they typically would have. They would get that reprieve going to school full time and full day. Even with the children who are in school full day, they're still dealing with the trauma of wearing masks and not really understanding fully, specifically the younger ones, what is happening in the world. And they're seeing in real time what is happening at home when they are at school, which is adding another layer of trauma and fear and concern to the already challenges that all of our children are facing right now as a result of this pandemic. So for this, as we're seeing an increase within our organization regarding the referrals from family members and parents regarding their children, we are seeking a full-time child and family advocate counselor who's a licensed clinical social worker to work with this increased need that we are seeing for children who are at home. All of our services during this entire pandemic have gone remote, and we are providing telehealth. Our safe house services regarding the number of children who are in our safe houses have been receiving counseling, group counseling, and individual counseling this entire duration of the pandemic. And we are just now starting to do in-person counseling for young children who have not been able to, they're managing very well with Google Classroom and doing all the Google meetups with their teachers. But in terms of counseling and therapeutic play, children express their feelings through metaphor and through play. And we need that real hands-on in the same room space for children. So we are looking for a full-time counselor to meet the needs across all of our 6 sites, 2 court systems, 2 shelters, as well as 2 community programs to meet the needs of the youth facing domestic violence in their homes right now. Thank you for your time.
Thank you. I see that you've applied for $50,000. Is that the salary of this position for 1 year?
That is, yes, that's a salary including the fringe as well.
Okay, how do you plan to absorb the cost of this position if needed the following year?
We do have grants out to other philanthropic groups as well as foundations in addition to this.
Okay. Any questions for Suzanne? Mr. Livingston.
Thank you. Just to follow up on Mr. Keity's comments there. So, you have your shelters in Norwalk and Stamford. Will you be applying to Stamford for any funds as well for this position going forward?
This would be specifically for the Norwalk and Stamford. I'm sorry, I wasn't clear. This would be specifically for the Norwalk court referrals, the Norwalk community program referrals, as well as the Norwalk Safe House. We do have a full-time individual currently working in Stamford.
Oh, great.
So
Okay.
we need that person to balance the responsibilities out. Right now, we have 1 person across 6 sites, and we need 1 person for each city. if you
Okay,
will.
great. That helps. Thank you very much.
Certainly.
Ms. Young?
Ms. Adams, so do you have any idea on what those numbers look like? You said there's an increase. So what are those numbers looking like?
It's challenging to I just actually got off a phone call today. We have one mother, for instance, who has 4 children. So we're looking at not necessarily just having the increase, but all of those 4 children need services. Whereas before, about 6 or 8 months ago at this point, maybe just one of those children would have been identified to having the needs. So right now we're in that process of assessing who is in crisis, who needs emergent, and who really could benefit from a family type of supportive system within family therapy or what have you. So I'd be more than happy to get that back to you once we get a little bit further down the road with raw numbers.
Great, thank you.
Any other questions? Okay, seeing none. Thank you, Suzanne.
Absolutely, thank you.
Okay. I've got like 5 screens open here. And next up, we have the Elder House. We have someone here from the Elder House. Okay, I think you're muted. You're muted.
There I am.
There you
Sorry. Thank you. Good evening, everyone. I am Denise Cesareo. I'm the Executive Director of Elder House. And as many of you know, and those of you that don't know, Elder House has been, for 47 years, has provided services to our most vulnerable older citizens. We know at Elder House from our years of experience, the effort that it takes to support aging seniors who want to remain living at home, especially those with chronic conditions, Alzheimer's, Parkinson's, dementia, diabetes, Lewy body. These conditions require extraordinary amount of personal attention and assistance with activities of daily living, feeding, dressing, bathing, help walking, and all those things that need to be given attention 24/7. When COVID hit and we had stay-at-home orders, we worked with the Newark Health Department to close our facility right away. We are a day program to close our facility right away and keep our older folks home, which put a tremendous amount of pressure on caregivers, because now it was up to the caregivers to provide all of those services and all of that attention 24/7. And as we know, and we're dealing with families, sometimes it's multi-generation families, sometimes it's a 87-year-old taking care of a 90-year-old, there's a spousal situation, all different kind of family situations, but now grandma or mom or Aunt Betty or whoever it might be is now living under your roof, and she needs more attention probably than your 7-year-old in a lot of ways, because it's all personal attention constantly. It's so mom doesn't leave the stove on, so mom doesn't wander out. So you make sure mom gets her medication. So mom isn't asleep in the recliner all day and then keeping the family up all night. So all of those responsibilities and all that care now went to a family caregiver. And what we did immediately at Elder House, because our facility was closed very early on in March, is we made sure we made daily check-in calls. We sent meals home every day just to try to keep that family unit together, because the stress again on the caregiver was enormous, and that stress then gets related to that senior citizen. The other thing that was happening when COVID hit, and we know that Fairfield County has the second largest number of deaths in Connecticut, and 90% of those deaths are over the age of 60 and 60% are over the age of 80. So when you take that and now put that extra pressure on caregivers to say, no, we can't go out, I know we can't do anything, and keeping those stay-at-home orders really affected caregivers. The fear was enormous. And after 5 months, we felt this pressure cooker of some of these families, because nobody really understood what was happening as they were trying to take care of mom and keep mom safe. And I use mom, 60% of our clients are female, I use mom. So in early in August, we opened our facility up. We knew we had to give some relief to this. If we could open up under very safe conditions 3 days a week and bring some clients in, very small amount, very small limited capacity, a couple hours a day, it might help relieve that caregiver, some of that caregiver stress. If I knew that mom could go to Elder House on Tuesday and Wednesday, yes, at least I'd have some of that time. And again, multi-generation families also taking care of kids that have to have school lessons done at the same time. So we did open in August. We opened in August. We have done extremely well, but opening meant obviously small numbers, small capacity maximum 8. Some days we can do 10. High staff ratios. We only could invite people back that could wear a mask and could respond to social distancing. And it's just costing an awful lot of money operationally. And we want to get through this period so that we can open our doors more often and to more people. But we're doing it very slowly and very safely. So what we are asking for is some operating assistance during this period to help support the staff, because I have to have a nurse on staff. I have to have a social worker in order to open our doors. There are qualifications that we need to qualify for the state. So those had to be in place. So we're talking about having many staff, few clients. 96% of our clients are under the poverty level.
Denise, sorry to interrupt you, but you're at almost 5 minutes.
Oh, I'm sorry. Okay.
It's totally fine.
I'm good. Thank you so much. I could go on and on. I'm so sorry. I apologize. But that's what we're looking for. Some operating costs and to help support some of the associated cleaning supplies and sanitary that we're doing every single day. Thank you.
Thank you for that detailed presentation. Anybody have any questions? Okay. All right. Thank you for your time. And I just remind all the applicants that you're free to go once you've presented.
Thank you. Good night.
Good night. Okay, next up we have filling in the blanks.
Hi, I'm Kristin Thomas from Filling in the Blanks.
Welcome.
So Filling in the Blanks is based in Norwalk, and our mission is to fight childhood hunger by providing children in need with meals on the weekends. Food obviously is so important for development as well as physical and mental health. And our core program is the weekend meal program, where we deliver a meal bag every week to the children enrolled in our program to bridge that gap from Friday to Monday when they may not have enough to eat at home. And often these meals are stretched, and the families report that the entire family benefits from these meals. This is the program that we have requested funds for. So we've been operating in Fairfield County since 2013 and in Norwalk since 2016. Before COVID, there was about 1 in 6 children in Connecticut living in food insecure homes, and Feeding America has reported that since COVID, that number's risen to 1 in 4. Before the pandemic, we were serving 611 Norwalk students in 10 locations. And from March to August, we added 780 students in Norwalk to the meal program. As schools have reopened and the logistics for safely getting the meals into the school and then home with the children have become a little more difficult, the numbers are slightly lower at this point. But in October, we added 3 brand new sites in Norwalk to our program. And in November, we are adding another 4 brand new sites in Norwalk with 165 children in those sites, which will bring the number that we're serving in Norwalk to 888 in 20 different sites this month. And we really only expect that number to continue to increase. So not only during these past few months, not only has the number of children in need increased, the cost of our food items going in the meal bags has also increased. So we are requesting funds for this program to provide a meal bag containing 4 meals and 4 snacks for 100 of these Norwalk children for 44 weeks in the year 2021. And the funds will also provide a reusable mask for each child in the program that lives in Norwalk. So thank you very much for letting me speak and for considering this.
Thank you. And how do the children find you?
So the schools now find us. When we started in 2013, it was our founders contacting school districts saying, we want to offer this service for the children in our community. And now, word of mouth, we're in almost 58. It fluctuates. It's really a week by week right now, because this, obviously everyone on this call knows, is a really uncertain time. 58 sites. So it's really, and our founders are on Stanford Food Collaborative calls and Norwalk Food Agency provider calls. So that's how we're reaching the Norwalk community, being a part of that organization and in community, so that people know we're offering this service.
So the schools offer your contact information to the children, and then those children bring it home and their parents kind of facilitate this, or is that how it goes?
Actually, no. So we don't have direct contact because the children are very protected with the parents. We only have the contact through the schools. So the school contacts us and says, we have 50 children in our school right now that desperately need this food. And then we enroll the school or the site, because we have after school programs as well. So a school, an after school program or a camp, we enroll them in the weekend meal program. Then we provide them with an information packet that explains the program and has a permission slip. They give it to the parents, and the parents return it to the school, and the school returns it to us. So the social workers, the schools are one of our most important partners. The social workers there are really running the program in the school, and then we deliver to them. So they give us the numbers, they tell us who needs it, and then we just meet that need.
Okay, so the food is delivered to the student's home, not the school.
Actually, it's delivered to the school on Friday, throughout the week, and it goes home with them on Friday in a various ways. Some, if they're small, their parents pick it up. Otherwise, it goes home in their backpack on Friday. Yeah, I'm sorry that wasn't clear. We did, during COVID, we were delivering at grab and go sites and bus routes, and we did have some volunteers and social workers that were delivering to homes, but they did that. We didn't deliver to the homes. We delivered to the people who could do that. But right now we're back in schools as long as they're open. And when they close, we will pivot again, and we will go back to alternate delivery methods.
Any questions? No? Okay. Thank you for your time.
Okay, thanks.
Next up, we have Malta House.
Good evening. Thank you on behalf of my agency, Malta House, for this funding opportunity. My name is Kim Killoy, and I'm a development team member and fundraising professional, and I've been with the agency since February. Malta House was founded in 1998, and our mission is to end homelessness among pregnant women by providing a nurturing home environment, support services, and independent living skills to pregnant and parenting mothers of all faiths and their children. The founders of Malta House recognized that there were far too many single mothers in our community who have never lived in a stable, safe, and nurturing home. Malta House is Connecticut's only transitional living program for vulnerable, homeless, pregnant, and parenting women over the age of 18. Malta House offers housing and wraparound services to assist mothers in establishing financial independence and housing stability. While it's true that there's other homeless shelters in Norwalk and surrounding areas, most will only offer 90 days, and they will separate the mom and the child. We are open 24 hours a day, 7 days a week, and 365 days a year. COVID has had a direct impact on our organization. The cost of running our residential and partner in success programs is substantial and represents about 61% of our annual budget. COVID-19 also forced us to postpone all in-person fundraising, and we're slowly opening up again, closely following the guidelines that the state of Connecticut offers. In addition, our gala was postponed from May until September. It's a $250,000 deficit in our budget, and we did pivot as we could, but since the funding really put the gap in one fiscal year to another, it really negatively impacted our revenue. We continue to find new grants and funding opportunities, and we are trying to limit our expenses as much as possible. During the height of COVID, we are one of only 2 congregate care facilities that stayed open and accepted new clients. During this time, we served 21 residential families. We had 13 new residents since March of this year, and we serve over 100 families with our community outreach program, which provides formula, diapers, and really any other donations we receive. And that's a bi-monthly event. We are respectfully requesting $50,000. This critical funding would be used to cover some of our case management staff salaries. Thank you.
Thank you. I know it's been a tough time for fundraising for everyone.
Mhm.
Any questions? Seeing none, thank you for your time.
Thank you.
I apologize. I actually skipped the Jewish Family Services, so I'm going to go back to them. Is there someone here from that organization to speak?
Hi, I'm Rebecca Konevsky. I'm the Director of Case Management
Right, apologize.
Education from Shoki Jewish Family Service. Thank you so much for inviting me to speak. Shoki Jewish Family Service has been around since 1975, and we are now today serving 17 towns throughout Fairfield County. We have always, since 1975, served Norwalk. So Norwalk has always been one of our service areas. We wrote our grant specifically to support 2 of our important initiatives, which have become even more important due to the pandemic, which is our kosher home delivered meal program and the Friedberg Kosher Food Pantry, both of which have seen exponential growth. We started with just a very small number of families, 12 families in the home delivered meals. We now have seen a 350% increase. All of the clients who are being served through our home delivered meal programs identify as lower income to extremely low income, and in this particular program, they are all senior, homebound, and elderly, and vulnerable. In our kosher food pantry, because of the pandemic, we've been doing monthly home deliveries to individuals, and for those particular deliveries, 79% of them identify as extremely low income and in need of assistance. 30% of our operating budget, 30% of my budget for case management emergency assistance goes to food relief efforts. And so what we asked from the City of Norwalk's grant funded program would be to enable us to help individuals provide more home delivered meals and supplement our existing food pantry efforts in order to access more of the items that we need. Oh, sorry, John. And that's, I mean, I tried, I'm sorry, I made it very quick because I thought I had 3 minutes. I'll make it quick. I can't.
John, you're muted.
You're muted.
I just had a whole conversation with myself.
Oh,
Well, I said, thank you, Ms. Konevsky, and I was asked the committee if there are any questions. Okay, thank you for your time.
thank you so much.
All right, next up, we have the Keystone House.
Good evening, everyone. My name is Kim Carter. I'm the Development Officer at Keystone. Keystone is a Norwalk nonprofit organization providing psychiatric rehabilitation services for adults with serious and persistent mental illness. We've been serving the Norwalk community since 1972, almost 50 years. We operate 3 homes and have a community integration program for clients living on their own. And in all, we serve over 150 people each year. All clients are low or no income. We're seeking funding to purchase and provide laptops to clients living in the community so they can access our programs and services during COVID. Connecting through COVID will help to ease the isolation and loneliness that our clients are experiencing since March from the COVID shutdown. Many are extremely lonely, isolated, and struggle not being able to access their support systems. Some of our clients have been hospitalized because they have decompensated to the point that they were not safe to remain alone. Laptops will allow our clients to continue to engage with our staff, use them for telehealth, telemedicine, and Keystone virtual support groups in their home. Staff will be able to work with clients virtually to ensure that they keep their medical appointments, psychiatric appointments, maintain benefit eligibilities, and access other community supports such as food banks and meal services. Connecting through COVID will provide services to clients in their home. This will better prepare clients for the isolation experienced by the COVID restrictions and allow Keystone staff to visually see them, which will allow us to identify if a client is decompensating or struggling so we can provide the necessary intervention. Thank you very much for this opportunity.
Thank you, Ms. Carter. Any questions? Tom? You're muted.
Sorry, one quick question on this program. With the laptops, is there a need for any sort of Wi-Fi accessibility or?
Yes, so what we have taken that into consideration and we've identified the clients that would need that. And we have put cost to that. We're actually thinking about hotspots or even, Wi-Fi. A lot of our clients aren't able to be able to put that in their names, right. But we have identified that.
Okay, great, thank you.
Any other questions? Okay, thank you.
Thank you.
Next up, we have the Maritime Aquarium.
Okay, thank you, John, and good evening, everyone. My name is Jason Patlis. I'm the president and CEO of the Maritime Aquarium at Norwalk. The aquarium is seeking funding from you in response to the severe impacts of the COVID pandemic on the aquarium and by extension on the community. Specifically, the funds we're requesting are for staff retention, would be allocated towards 13 full-time employees, all of whom are Norwalk residents. All but one fall within the low to moderate income bracket that's provided in the application requirements. The funds would cover the allowable thresholds for our payroll expenses over a 9-month period when we are particularly struggling to meet payroll. In providing funds for staff retention, these funds would respond directly to the COVID pandemic. Economic dislocation and job loss has been among the most significant debilitating impacts of the pandemic on our community across the nation, as we've seen. The Maritime Aquarium has long been an economic driver for the city and the state, with a large staff, full-time and part-time employees, and as a draw for nearly 500,000 visitors, that is in a non-pandemic year. And with those visitors, we benefit restaurants, stores, and the entire community. As you may know, we were among the first aquariums in the country to close our doors in response to the pandemic. We were closed for 3.5 months. Over that time, we lost about $3.3 million in revenue. As an aquarium, we're responsible for 7,000 animals in our care, some of which come with state and federal obligations. And we need to maintain our animal care team, food and medicine, our physical plant, utilities, whether we're open to the public or not. And even now that we're open with about 50% attendance compared to past years, we're still operating in a negative cash flow because we have those expenses to maintain. Just to give you a sense of numbers, we're looking at we've reduced our expenses by about 20%, but we're still projecting decreased revenues of about 33%. And in dollar terms, historically, our budget's been about $12 million annually. We break even year in and year out. This year, we're looking at about expenses of $10 million against revenues of $8.5 million. And that gives you a sense of what we're up against. We do have an aggressive fundraising campaign underway that is targeting private donors. We are seeking state support, but your support will help us make up the shortfall to cover salaries and to get us through this particularly challenging time. Let me just take a moment to go over the benefits that we bring to the community, some of which you know, but all of which are profound. We're the state's second largest family attraction. We reach 80,000 students through our educational programs. 40% of those students receive some kind of financial support to join our programs. Our impact is greatest in Norwalk. All Norwalk public schools join our programs free of charge. We're a founding partner for the Maritime Odyssey Preschool, the city's largest preschool, and all of those staff and student families can come to the aquarium free and get free membership. 14% of our visitors are Norwalk residents, 12% of our members are Norwalk families. The pandemic's taken a tremendous toll on all of us, continues to take a toll on the aquarium, but we are enthusiastically fulfilling our mission. We're open to guests with new protocols, new procedures, again, which have been a real challenge for us, but which we are implementing fully, and with which our guests are obliging very well. We've brought our programs online, so we're reaching people in the comfort of their homes, and we're working with schools as we can. And so we continue to fulfill our mission as best we can, even under these trying challenges, these trying times and these challenging conditions. But with your support, we're looking forward to getting through. Thanks very much.
Thank you, Jason. I know the Maritime's a crown jewel here in Norwalk, and I'm sure you have some very high operating costs. Quick question: have you been? Are you guys still selling the family passes?
Family passes, you mean in terms of membership?
Correct.
Yes. That membership has been one of our toughest challenges because while we're seeing good attendance numbers, they've been above budget at about 55%. When we were projecting they'd be 50% or below. Membership has really just not been there. People are nervous about what our financial status will be. They don't want to put in a year's investment if we're going to close. They're nervous about what the pandemic's going to present, even if they buy a membership that allows them to come in over and over again. They're not sure what next month's going to bring. And so
I get it. It's like booking a vacation right now.
That's exactly right. And those membership revenues are really critical because the earned revenues we get, attendance revenues, help us with the gate. But it's the membership dollars that cover a lot of our overhead and our general admin costs. And we're without those dollars right now.
Got it. Any questions for Jason? No? Okay. Thank you, Jason.
Thank you all.
Okay. Next up, we have the Mid-Fairfield Child Guidance Center.
Thank you so much. Hi, everyone. My name is Marissa Mangone, and I am with Mid-Fairfield Child Guidance Center in Norwalk. For those of you unfamiliar with our work, we are an outpatient children's behavioral health clinic and work with well over 700 children and 1,500 family members every year. Our services include outpatient and psychiatric services, extended day treatment, in-home and school-based services. Many of our children struggle with a wide variety of mental and behavioral health needs, including anxiety, depression, PTSD, and as you can imagine, in COVID times, those symptoms have increased significantly. In March, as a response to COVID-19, we quickly shifted to a WebEx telehealth platform. And while many of our clients have embraced that technology, we do have some children and families, for a variety of reasons, that have been unable to successfully access the telehealth platform, whether it be they need more intensive treatment, whether there be language barriers, and or they just don't have access to technology. So we are requesting funding to support COVID mitigation technologies, so that way we can have some of our children and families come in to receive face-to-face teletherapy. In August, we began a phased-in approach to again start seeing clients and families in person as needed. And so our funding specifically is to purchase air purifiers and UV lighting to again ensure that we have a safe environment for our families and children to come in and receive services because it is so needed. So I know that was quick, but I hope you'll consider supporting our agency. We've been in the community for well over 60 years and are a great organization that does so much for the children and families in Norwalk.
Thank you. And I see you're asking for a specific modest amount of money for a specific reason. That's you don't see that too often.
We are, and I know that there's so many wonderful nonprofits out there and can hear them all tonight. And it's amazing the work that everyone is doing. So we just try to be very mindful of our asks. And again, this is very specific so we can, help the children that need the in-person face-to-face services.
I think this is the first time I've seen sense on a request. Well, thank you. Any questions? Okay, great. Thank you very much.
Absolutely. Thanks so much.
Take care. All right, next up we have the City of Norwalk Community Services Early Childhood.
Hi, everybody. I'm Mary Oster. I'm the Early Childhood Coordinator for the city. And I wrote the grant on behalf of early care and education programs in Norwalk for increased PPE and cleaning services. So there are 11 early care and education providers, all small businesses in Norwalk that serve low-income families and children ages 3 months to 4 years of age. They operate high-quality, safe, licensed, and accredited childcare so that parents can go to work with the assurance that their children are being well cared for. Even before COVID, maintaining a high-quality childcare program has always been financially challenging as programs balance providing high-quality care, paying their staff a competitive salary, and providing a service that families can afford. And this has become even more critical during the pandemic. Some of our early care and education programs remained open through the spring shutdown. Others closed, but always provided virtual learning opportunities for the children and referral services for the family who were already struggling. They are our lowest income families oftentimes, and they were already struggling before the pandemic. And so that's been further exacerbated throughout. All of our programs are currently open and are maintaining an even higher level of cleaning and sanitation. And for any of you who have ever been in early childhood programs, you know that already they maintained a very high quality of cleanliness. So with this, they are really struggling to pay for the extra costs of cleaning. They've added staff hours, they've increased cleaning service hours if they had one. Perhaps they've added a cleaning service to come in on a weekly or daily basis. And they're also using more PPE than they've ever budgeted for. And in the case of things like disposable gloves, they have doubled in price. They've gone from $45 a case to $90 a case. It's my privilege to introduce Rovita Paul. Rovita is an owner and director of the Children's Playhouse with 2 locations in South Norwalk. And she has just a few words to say.
Good evening. As she said, my name is Rovita, and I want to say to you, it doesn't matter what the level of transmission in the community, every child care program has to plan to protect the staff, the children, and their families from the spread of COVID-19. In order to plan ahead to ensure that adequate supplies to support hand hygiene, behaviors, and routine cleaning of objects and surfaces, we have had to be able to budget for these supplies. Due to the demand for such supplies, often the prices are inflated, which causes a financial hardship to the programs because budgets cannot be adhered to. We need financial help to offset some of the costs because budgets have been stretched to a point of exceeding what was allotted. Due to the frequency of disinfecting the toys, blocks, and high-touch surfaces, we are purchasing an inordinate amount of disinfectants, gloves, hand sanitizer, wipes, and disinfectant sprays, which are requirements from the CDC to maintain protocols. Because of the challenges that our families are encountering on a personal and financial level, many of our programs have had to offer the following: breakfast for the children. Often families can't afford lunches for their children. We have had to, in some cases, prepare bags for them to bring home as a supplement to add to their dinner. While there is a uniqueness to all of our programs, we are all finding that we have had to extend ourselves to families in different ways, like providing warm attire, different kinds of clothing, hats, jackets, ice packs, diapers, hardships to plan for tuition payments. We do all of this because our families need us. They cannot work, and their children need to be offered some form of normalcy to their everyday life. Last but not least, we all offer quality educational programs. Thank you.
Thank you, ladies.
Very much.
Thank you, ladies. Any questions? No? Okay, thank you. All right.
Thank you.
Next up, we have the Norwalk Senior Center.
Cry. Embarrassing. My mom goes, he's out of his fucking mind.
If you could please mute your mics, that'd be great. Thank you.
Hi, thank you, John. Good evening, everyone. My name is Beatrix Lane, and I'm the Executive Director of the Norwalk Senior Center. The Norwalk Senior Center has been serving the 20,000 plus seniors and elderly of Norwalk for almost 50 years. We have a wide array of services, activities, and programs designed to help seniors thrive and remain independent in their homes for as long as is safely possible. Services include benefit assistance, outreach to the homebound, information and referral, transportation, translation, exercise, recreation, socialization, Meals on Wheels, for which this application is for, a lunch program, health screenings, lifelong learning, a tech learning center, travel, trips, and more. The global pandemic made it necessary for us to act in an abundance of caution and close our doors. However, in response to COVID, we have kept right on providing benefit assistance, outreach by phone, including wellness checks, Meals on Wheels, senior grocery bags, which was a new collaborative yielding free bags of groceries delivered to seniors' front doors across Southern Connecticut, information and referral, exercise by Zoom, so I've come up with a new term, I call it Zoomercise, transportation to grocery stores, doctor's appointments, and pharmacies. These services have helped seniors and the elderly shelter in place during this most challenging time. We continue to provide these services in a very safe fashion, including social distancing, lots of PPE, and asking plenty of health screening questions. Meals on Wheels program staff is working longer hours to coordinate the demand for meals, as well as the training and equipping and supervising of a brand new army of 40 young volunteers. We make sure that folks, regardless of age or ability to pay, receive meals that are safely delivered to their front door, be they disabled, recovering from an injury or illness, are frail, or are in quarantine. This is an essential service. We are requesting funds to create a reserve fund for folks unable to pay for the meals for any reason, and to cover the costs related to increased staffing necessary for the Meals on Wheels program during the health crisis. Thank you for your consideration.
Thanks, Beatrix. I actually thought about you when all this COVID stuff started. Hope you're doing well.
I
As well.
am. Thank you so much. Thank you.
You're welcome. Any questions? No? Okay. All right. Moving on.
Thanks so much. Have a good
Thank
night. Thanks.
You too. We have person to person up.
Hi, good evening. My name is Nancy Coughlin. I'm the CEO of Person to Person. Thanks for inviting us all to speak tonight and for championing all of the nonprofits in the Norwalk community with this program that's so incredibly vital. Person to Person is a social service agency that's been serving the Stamford-Norwalk corridor, including the 7 surrounding communities. Since 1968, we're over 50 years old. We create access to economic stability through 3 food pantries, a clothing center, an emergency financial assistance program that provides help with rent, security deposits, utilities, and other unexpected bills and invoices. We have a summer campership program, and we have college scholarships and vocational scholarships. Tonight, we're requesting funding for our emergency assistance program that incorporates our Norwalk food pantry and our Norwalk emergency financial assistance program. And housed within our Norwalk food pantry is a program that we call Door to Door, which is our home delivery program for food. The need for food assistance during the pandemic has been well documented. Several people have already spoken to this tonight. Food insecurity rates in Connecticut have increased from 11% to 23%. In addition to that, 30% of Connecticut renters say they don't know if they'll be able to make rent next month. And 46% of Americans say they're facing serious financial problems. At Person to Person, we are proud that throughout the pandemic, we never closed. We've been open 5 days a week, the entire time, and alternating Saturdays. So some days, 6 days a week as well. And we're the only food pantry in Norwalk that maintains those full-time hours. We have seen, like everybody, a tremendous increase in demand during the pandemic. Our food assistance program is up 60%, and our emergency financial assistance program in June, we peaked at 380% more financial assistance provided than June of 2019. And while we've seen fluctuating demand in that program, it's been up and down a little bit. We're seeing rates of demand increase again. In the beginning of the pandemic, most of the requests we were receiving were for rent assistance. That is still true, although we're now seeing as well requests for utility assistance increasing. So in a typical year, agency-wide, we would provide services to 25,000 people last year in all of 2019. This year, so far in the first 9 months, we've already served 28,000 individuals. In our food assistance program, we've gone from 13,000 individuals to 25,000 individuals. And of that, Norwalk residents, we're serving about 1,000 people every month. We've already provided to Norwalk residents 600,000 meals.
Nancy, sorry, you're at the 3 minutes.
Oh my goodness. What do I want to highlight? I want to highlight that I guess our emergency financial assistance program as well has seen tremendous increase. Our programs are designed by nutritionists to really have an impact. We are already seeing people who are just feeling very overwhelmed and not even sure where to go to begin accessing resources. So we design our programs to make sure they're very low barrier to access, low barrier to entry, accessible to everybody. Funding through this grant could provide for enough food for 40,000 meals. It could provide rent for 50 families. We're incredibly grateful for this partnership now more than ever. We know that we're going to be facing hard days ahead. It's going to get worse before it gets better. And we are really grateful to have such strong partners at the table. So thank you for everything that you're doing.
Thank you, Nancy. I mean, it was brought to my attention. You guys the demand on you in person to person is through the roof right now. And you've done a great job just trying to keep up. Any questions? Great. All right. Have a good night.
Thanks so much.
You're welcome. Next up, we have Stepping Stones.
Good evening. I'm Bill Jeffries. I'm the VP for Fund Development at Stepping Stones Museum for Children. As many of you know, Stepping Stones has been temporarily closed to the public since the pandemic started. Although our on-site preschool program, as well as 4 additional preschool sites in Norwalk public schools reopened this fall. However, our important work in the community never stopped. While the museum has been closed, staff have been working around the clock to develop a host of new virtual and COVID wraparound services for area families based upon survey content we were receiving, with a particular concentration in social emotional supports for children through the pandemic. This work included developing and disseminating fun, STEAM-based weekly virtual content with accompanying COVID-19 resources for families to use throughout the remainder of the previous school year. Working with Norwalk Public Schools to develop and implement hybrid, virtual, and in-person civic engagement investigations for preschool through grade 8 students through the Norwalk Summer Academy. And in partnership with the Connecticut Department of Education, the presentation of KC 2020, which is a 2-day virtual kids convention that highlighted the everyday acts of democracy from local, state, national, and international perspectives. Through this work, we've served over 200,000 children and their caregivers and teachers. Of that number, we estimate that 25% of that number were from Norwalk. That's 50,000 people. Now the museum is devoting its attention to implementing a phased reopening plan and launching a Stepping Stone Studio program that will greatly expand both the volume and depth of our virtual and in-person offerings over the next 6 months. Our proposal tonight requests job retention funding for 6 critical museum staff that are needed for the museum to continue this work. And this particular request only covers a salary and not fringe benefits. These staff all live and work in Norwalk, and they each meet the income requirements stipulated in the funding RFP. The requested salary report will fund the salaries over a 6-month period until the museum is able to equalize its earned income stream once the reopening process has reached a more mature stage. To this end, the museum will also be working with the Connecticut chapter of the Harvard Business School Community Partners Program during the same period to undertake a market analysis for the creation of an e-commerce learning platform that will greatly improve free and reduced cost accessibility to these resources and potentially serve as a new earned income revenue source for the museum. The positions included in the proposal will be essential to the launch of the e-commerce platform, as well as to other critical operational and programmatic parts of our mission going forward. We really, really appreciate you reviewing our request tonight. Thank you very much.
Troy. Thank you, Mr. Jeffries. Any questions? Mr. Serenidis.
Mr. Jeffries, how many positions are we talking about?
There are 6.
6 positions?
Yes.
Full-time?
They're all I'm sorry?
Full-time, part-time?
They're all full-time. Yep.
Thank you.
Mr. Jeffries, are these employees currently receiving unemployment?
No, they're all fully employed. But unless we receive this additional support, we are going to have to start laying staff off. And this is why we need the support.
You were closed for 3 months. You're currently open.
We are partially open. The preschool, the lab school preschool is the only open component of the museum right now. All of this work that I described has been done remotely by our staff.
Okay. So during those 3 months, were these employees let go and had gone on unemployment, or no?
No.
They were all retained through the entire 3 month
Yes.
closing.
Yes.
Oh. Any other questions? All right. Thank you, Mr. Jeffries.
All right. Thank you. Good evening.
Good evening. Next up, we have Supportive Housing Works.
Good evening. My name is Pam Ralston, and I'm the Director of Opening Doors Fairfield County. For a little background, ODFC, Opening Doors Fairfield County, excuse me, is the local HUD designated continuum of care for Fairfield County. And we're responsible for administering and operating and applying for funds to operate projects that support individuals and families who are experiencing a housing crisis. Supportive Housing Works is the applicant for this funding as the backbone organization for Opening Doors Fairfield County, and Supportive Housing Works serves as its fiduciary. So this application was submitted by Supportive Housing Works on behalf of Opening Doors Fairfield County. We're applying for funding to stand up a rent relief program for residents, Norwalk residents, who are at risk of eviction as a result of COVID-19 and the economic downturn. Excuse me, over the past 7 months during this pandemic, ODFC has created a number of new initiatives that are in place to respond to the housing needs of Fairfield County residents. Some of those are funded by the CARES Act stimulus funds and primarily focused on people who are currently experiencing homelessness. Unfortunately, many of the people who are currently experiencing housing instability and are unable to pay their rent, and for so many people, this is really the first time that they've ever experienced something like this, this type of instability. They haven't qualified for most of the programming so far simply because excuse me, HUD eligibility requires that participants in programs are currently experiencing homelessness, literal homelessness, which includes, the meaning is that they'd have to be in an emergency shelter or unsheltered to be able to access support. Since HUD doesn't prioritize for support for people who are currently housed, no matter where they are, that includes that people could be households doubled up or tripled up in very crowded conditions, which of course is against the CDC protocol for social distancing at this point. Our priorities include preventing homelessness and serving those who are experiencing instability, but really trying to serve them while they still have housing. So we're looking more at programming options that are on the preventative side to help folks that are unable to afford their housing payments and who may become homeless as a result. And for that reason, we're really focusing on efforts for rent relief and eviction prevention programming for this funding. The prospective participants will be assessed using a risk of eviction assessment using a standardized tool, and the program will ensure that eligibility criteria is followed consistently, including income threshold.
Pam, sorry, you're at your 3 minutes. If you could.
I'm so sorry, that was so
No
fast.
problem.
Just in closing, I would just say that it'll be very difficult for Norwalk and all of Fairfield County over the months ahead to handle the expected cliff of evictions. And the purpose is really to divert as many households as possible from becoming homelessness. So thank you. That was
Pam,
fast.
quick question.
Yeah.
Pam, hasn't the government put in place some, put a stop to evictions until a
Yes,
certain
actually
set date?
yeah, so that was part of my, what I was actually going to include. The eviction moratorium ends at the end of this year. It's been extended a few times and it likely will be extended. The problem is at the same time, people are not paying their rent. They're, falling further and further into debt. Those debts are not going to go away. They're going to have to pay the landlord at the end of the moratorium. At the same time, landlords are not getting paid. So for the past 7, 8, 9 months, some of them are not receiving the rent that they pay their bill, that they used to pay their bills. So funds go directly to landlords, not to tenants. And so, people who are operating property as a small business, they're heavily affected by the lack of being able to collect rent as well.
Right. Ms. Young, I saw your hand up.
Yeah, I just wanted to ask Ms. Ralston, are you coordinating with person to person at all? Or any other Norwalk organizations?
We have never applied for this before. We're only applying. We don't normally compete with other organizations. We're applying primarily because this funding was put together as an executive order to really support states and municipalities who are experiencing high levels of unemployment and loss of business. And that's why Connecticut was prioritized for this funding. So again,
I realize why we have the funding. I'm just wondering because I know about the regional organization that you deal with. So if you don't
we
work
would
with
definitely, we have a coordinated access network that we would be prioritizing households who are most in need. And we would absolutely, work with any organization who is serving, working on the same effort to support households who are behind in their rent and who need support.
Any other questions?
Thank you.
Great. Thank you for your time.
Thank you very much.
Okay. Next up, we have the Triangle Community Center.
Good evening, everyone. My name is Edson Rivas. I am the Interim Executive Director here at the Triangle Community Center. We are Fairfield County's LGBTQ community center and the only one around the area as well. Like many nonprofits, all of our services, when the lockdown happened, we were able to transfer everything to the virtual space, whether those were mental health services, our case management, and all of our programming, whether that was peer-to-peer support groups or social groups, were easily transferred over. Unfortunately, some of those solutions that we sought at that point were short-term solutions. We didn't think that the pandemic was going to last as long, and I don't think anyone did. So we are currently seeking funding to help us put in place infrastructure for us to continue working efficiently in the stay-at-home or work-from-home environment. Currently, we're seeking a cloud-based software solution that can handle all of our case management and mental health services along with our programming. That includes an EHR solution that could help us do everything on a mobile-friendly platform and that could take care of everything without the need of paperwork or mailing out forms, which will greatly decrease our administrative hours. And those hours could be put towards more client services or client-facing services. Currently, the mental health crisis, as many of you know, is only exacerbated by the isolation, the lockdown, pandemic, and uncertainty in the country. And this grant would greatly help us increase the bandwidth. Currently, we've been able to double our numbers in mental health, even without advertising or marketing efforts. I would love to continue expanding those services, but I fear that without the proper infrastructure, it's not going to get the results that I would like to get. And that's it. Short and sweet.
Thank you, Mr. Rivas. Any questions? Great. Thank you and have a good night.
All right, thank you.
Okay. All right, last but not least, we have the Norwalk Development Agency, CDBG admin. I don't know, Brian, I see Mr. Bedoli, and I see you, Sabrina, on the call. Who would like to take this one?
I can, John.
Thank
Good evening, everybody. Hope you're doing well. The funding request you have before you is for funds to administer all of the grants and the funding process around the CDBG CV program. Recognizing the overall need that the pandemic has brought into our community here, we're putting in for half of the typical allocation. I'm hoping to pass on that marginal cost savings of administering multiple programs on to the actual programs and public services in the community.
It was short and sweet. Okay. All right. Any questions for Brian? Seeing none. I guess I will now close the public hearing and thank all of the applicants for their time and the committee for being here. And now I will move on to open up public participation. Is there anyone here that would like to speak to something that is on the agenda? I see someone is under the chat feature. Thank you. No. Sabrina, is there anyone here to speak? Signed up, not a part of, no? Okay, great. I will now close public participation, do a little administrative work here, and that's item 1A, approval of the minutes of the September 17th, 2020 meeting. Would someone like to move that? Thank you, Mr. Sirenides. Everyone's on camera right here, right now, right? All right, let's do maybe a little less informal. All in favor of the minutes of September 17th, 2020, please raise your hand, signify yes. Let the record show that is unanimous. Okay, moving on. Item B. A, advance the Common Council the amendments to the PY45 Annual Action Plan and authorize the Mayor Harry W. Rilling to execute any and all documents associated with the submission to HUD. For everyone, this is the submission of the requests. We're in a tough spot. We've got, what is it, $1.3 million in requests, a little over that, and we've got $808,000 in funding. So it is my opinion that we need a little bit more time to digest this, have a few more conversations. My intention is to do what I've done in the past, and I believe everyone has gone through a CDBG process at this point, where everyone's input would be inputted, choices will be made democratically, and we'll hopefully be able to get everyone their top choices on who gets all this funding. If there are no objections like that, I'd like to make a motion to table this item to the next planning committee meeting. All in favor? Opposed? Abstentions? Tom, did you support?
Yeah, I support it, definitely.
Okay. Let the record show that it's unanimous that this item will be tabled to the next planning committee meeting. Okay, next up, item BB. Actually, no, excuse me, 2B. Advance the Common Council amendments to the 2020-24 Consolidated Plan and PY46 Annual Action Plan and authorize the Mayor Harry W. Rilling to execute any and all documents associated with the submission to HUD. Brian, do you mind giving the crew a summary of what you're looking to do and what this is?
Yeah, no problem. So, in taking the reins here at the agency, we wanted to do a sort of a comprehensive review of our internal CDBG management practices. So that started, of course, taking a look at the plans and also just sort of reporting structures that we have to adhere to per HUD guidance. So we brought in a consultant. We went through a comprehensive review of our entire program. Taking a look, kind of looking under the hood and trying to figure out ways we could optimize the whole grant management and reporting process. As a result, we've identified a few modifications to the recently approved 2020-2024 Consolidated Plan and the correlated Annual Action Plan, the PY46 Action Plan. We went through it with the consultant, trying to identify areas that we could adjust per HUD best practices. All the projects are really staying the same. what it's doing is it's kind of reorganizing the overall structure of the report, because that feeds into our ultimate online reporting functions. So we'll be able to do a little bit more, well, a little more consistency in terms of how we're reporting, and it'll just improve our overall workflow with HUD. So a lot of that's more administrative items, and they're reflected in the overall packet. I think it's in red and track changes. As part of that, we were fortunate to identify some additional resources that we were able to purpose back into existing projects, and also try to create more opportunities to kind of help and deal with the current need in the community, recognizing the tremendous need versus the actual allocation that we got for coronavirus projects and the like. So what we've effectively worked to do as part of this amendment is to repurpose some funds that were originally allocated for the Walk Bridge project to the tune of $300,000 to be cycled back into the economic development portion of our program. And I know we've kind of discussed this contextually in order to provide more resources based on some of the presentations we've heard tonight. And then also we were able to reallocate some of the program income expenses to cover public facilities project, economic development, and then support some of the work at the South Norwalk train station from a planning and admin perspective. So that's really the sort of high level overview of the changes, and I'd be happy to go through anything with you. This will of course enable us to provide, the biggest point is to provide some additional resources, recognizing the big gap in terms of the requests that we received, as well as what funding is currently available.
Any questions? Okay.
Well, actually, yeah.
Tom?
So thank you, Brian. Just on that Walk Bridge funding. So we talked a little bit about how that might be available. Where does that stand? Available for other uses?
That's what effectively this action is. That's what we're doing. We're repurposing it out of the Walk Bridge and putting it into our economic development category. And then we'll be working with the selected applicants to develop the actual program.
So that would be the next step.
Correct. Yeah, but this is enabling that.
Gotcha. Okay.
And just so you know, just as additional background, some of the program income that we are reprogramming, I have as sort of a backstop just to provide a little cushion in there for that. And maybe we could be able to use it later down the road.
Yeah, just want to be sure on that. Thanks.
Yep.
Anyone else?
David. Sorry.
Darlene, and then if there's no one else, Mr. Hewleman has a question. Darlene? You're muted.
Can't hear you, sorry.
Stop yelling.
So are you saying that 300,000 is going specifically to CD to this application process here to these folks who applied currently, or can it be used for some other time for other efforts?
Yeah, so it's actually not directly related to the coronavirus, but what we're doing is we're taking the 300,000 and putting it into the economic development portion of our PY46, which gives us flexibility to do that if that was the desire of this group.
Okay, so it's not,
yes, it is available. Yeah.
Okay. So it's not necessarily going to make up the difference of anything right now, what we heard. That's all so it's not just that. Okay. I just needed that clarity. Thank you.
Any other questions from the committee? Seeing none, Mr. Hewleman.
No, that was Darlene actually asked the question that I was going to ask. So thank you, Darlene.
Okay. All right. Seeing no other questions, I will now call for a vote. Would someone like to move that? Thank you, Mr. Livingston. All in favor, please raise your hand to signify yes. And seeing all the hands, let the record show that is unanimous. Okay, moving on. Item 2C, advance to the Common Council for its consideration, the authorization of the Mayor, Harry W. Rilling, to execute a contract with Dorenberg Kallenbach Advertising, provide tourism branding and marketing service in a sum not to exceed $100,000, account number noted. Would someone like to move that? Come on, thank you, Mrs. Smith. I believe, Sabrina, you will be speaking to this.
Yes, I will. Hi, everybody. Happy to be here. Happy to be your host, as always. So as you guys know and may have been a part of, the city reorganized probably almost 2 years ago now, which created my wonderful Department of One for business development and tourism. I've kind of been a jack of all trades, but I was handed this position with a totally new department, which is amazing. So I've had to kind of ride my own wave, build up my own materials, and, you know, start from scratch and really try to hit the ground running as best as I can to help as much as I could. So now I'm finally, you know, in my first season of having funding to actually do anything with. So this is actually my first capital project that I'll be executing. Obviously, it was super delayed because of, you know, staffing and COVID happening and City Hall being closed, all that fun stuff. But we finally got through the process. So you may or may not know that we did not have a specific tourism person or department at all before this department happened. So I have no materials, I have no website, I have no banners, signage, I have none of that stuff available to me. So I kind of have to start from scratch. And this contract is really to bring on DKA. I believe Todd is on the call as well, who is the consultant for the project. If you have specific questions for them, I'm sure he's happy to answer them. But this will essentially create the website, create the social media, and create the content for that so we can actually execute a tourism strategy that makes sense. And it's not just a marketing contract. In addition to this, I'm having Todd's group propose what we should be spending for advertising dollars after everything's created. So usually, you know, we do a marketing contract, we get the website, we get, you know, all these great materials, but then we drop the ball when it comes to actually executing and promoting our own selves. So his group will also be tasked with creating that marketing plan for me so that I can make an operations request for advertising so we can actually, you know, push our brand out and let people know that we're here and try to draw visitors and, you know, even businesses as well to come to Norwalk, and for a resource for our residents too, to see what's going on in the city and what's happening there. And I just wanted to mention they're the same consultant that is now taking over Norwalk Now's platform, but that's very small business centric, and it's really to be hand in hand with the business owners. And I actually really see it as a benefit to have the same group, because that will integrate the two efforts very seamlessly so that our small businesses aren't missing out on the tourism aspect of, you know, being a business in Norwalk. So just a little background, we did a full closed bid RFP process. The amount of money was not indicated in the RFP. The chosen group was the lowest bidder, and also in our eyes, regardless if they were or not, and of the committee, they were the most prepared and most fit for us. They have a lot of experience in the state. They're based out of Connecticut. They're familiar with Norwalk. I actually gave them a tour the other day for 3 hours. So God bless them for being able to hear me talk for 3 hours. So we've been hitting the ground running already, but they're definitely the best choice for us. We had 14 applicants. Of those 14, we selected 4 to have interviews with us. And of that 4, DKA was the clear winner for all members of the committee, which the committee included members from the aquarium, members of staff, and obviously the purchasing department and the redevelopment agency. So we are kind of all efforts on this one, just so that we can make sure that whatever we come up with is dictated by a committee and by the public that kind of makes the most sense for us, and that'll fit us really well. So I'm excited for this to get started. We do have them on for a year for $100,000 for this contract. I am asking next year to include them in my budget as well, but I would come back to you guys for that second approval for the following year to just also give you guys an update of kind of what's going on, what we've created thus far, and how we're doing. So that's really it for me. And like I said, Todd's on the call. You'll see his little square on the Zoom. So if you have any questions for him, I'm sure he's happy to answer them. And I'm happy to answer any questions you guys have as well.
Todd, are you ready for your 45-minute presentation? No? Okay. Actually, I think this is great. I think I'm glad we've got, you know, the same company doing, you know, playing these roles. I think this is long overdue. Any questions for Todd or Sabrina? No? Okay. Todd, you want to say anything to the group before we clock out?
It's a pleasure to meet you all virtually this evening, and I've been listening to all the presentations tonight. And I think, you know, Norwalk's just a great community. In addition to working with companies in the economic and development and tourism sector, we work with a number of nonprofits as well. Everything from, you know, social services serving basic human needs to arts education and attraction, entertainment attractions like the Maritime Aquarium. And it's just wonderful to see how responsive everyone is to dealing with COVID-19 and being able to serve their communities and clients. So it's been a nice evening, just kind of watching all of it unfold, and happy to be doing our part to, help really create an overarching and distinctive identity for Norwalk as a great place to explore, dine, shop, play, stay, and even beyond that to live, work, start a business. So happy to be on board with you guys. And Sabrina, as she mentioned, has done a great job of onboarding us. We are here in Connecticut, as she mentioned, and certainly we're learning the intricacies of the city as we get going, and just happy to be part of it. So thank you for choosing us.
I do have a question.
Certainly.
So maybe this doesn't connect, but has there been any talk about whatever you create to kind of make it connect with our city website?
Yeah, I mean, certainly we've noticed that you have, you developed a brand that's on many of your screens tonight. I've seen as well too. Norwalk, the sound of Connecticut, that is become sort of the omnibus brand for the city, as well as it has a tourism flavor to it, I think, as well too. I think that this is the real opportunity is to work with the community and determine what an overall brand might be for Norwalk, and whether that supports all boats rise with high tide, as they say, in regards to tourism and business development and things of that nature, or in fact we look at perhaps the city website as being the municipal hub, and there is an opportunity here to separate and create a true destination brand for visitation in support of getting people to interact with the city in that regard too. So it's an exploratory process, but certainly we have worked with communities who have one overarching brand. We've worked with others who've kind of split it, if you will, between the municipal website serves these functions. It certainly serves as the hub for minutes and businesses, how to get your dog license, how to pay your taxes, and yet there's another entity that serves tourism. But those two should certainly connect and be collaborative and coordinated.
And Todd, Sabrina, if you don't mind, excuse me, coming back to the committee and say 2-3 months and giving us an update on what you've been up to.
Absolutely.
Sure. Absolutely.
Great. Any other questions? No? Okay. Thank you. All right. I believe that is all she wrote. Everyone, thank you for coming early and interrupting your dinner time for this. But now just think of it this way. You've got the rest of the night ahead of you. So that being said, do I have a motion? Thank you, Ms. Shanahan. All in favor? All right. Thank you, everyone. Have a great night.
Thank you, everybody.
John, did you make the motion to approve the project?
Oh.
I'll motion for that.
All right. Moved by Ms. Shanahan. All in favor?
Thank you.
Record show it's unanimous. Thank you. And then double motion to adjourn. Thank you, everyone.
Good night.
Night.
Good night.
Right.